1 in 4 Americans suffer with chronic pain, and that shoots up after 50. People don't think about the effect of chronic pain in a relationship, especially in intimate relationships.
Did you push record?
Thank you so much for tuning into Our Second Act with Paige and Silka.
For your second act of life. Hey, Silka.
Hello, Paige. Paige, today, we always say we live what we bring you, and you're living what we're bringing you very, very intensely today. I live it actually constantly to a lesser degree, and that is chronic pain. Yeah. People don't think about the effect of chronic pain in a relationship, especially in intimate relationships. I want to talk about that today because, you of course had an acute issue that is now developed into a chronic issue, and, arthritis, fibromyalgia, that sort of thing. 1 in 4 Americans suffer with chronic pain, and that shoots up after 50. So if you're not suffering from it, somebody you know is, and you're likely in a relationship with someone. Talk to me about that.
Oh, I love how you give me big, broad subjects to jump into. So, yeah, like you said, chronic pain is chronic around the world. That's the best way to say it. So the big thing is there's a patient who has it, and then there's the loved one or loved ones around the patient who also are collateral damage to it as well. So what do you do with it? Because pain can be, as you know, Silka, debilitating in every way. So where to begin? In relationships, let's back up a little bit. But before you go through chronic pain or your loved one has a chronic pain type of illness, what's the relationship been like before that? Are there problems in the relationship? Have they never been addressed? Are there underlying issues that are like right on the edge of being volcanic? So you always have to look at where were you before the medical condition or injury started? Because I'll tell you, when you've got chronic pain or you're with somebody who has it, all of that is going to start to surface up on top of the chronic pain. So we'll start with that. So does that make sense, Silka?
No, it makes sense, and perhaps we should discuss how it shows up. One of
Yes.
Go ahead.
Yes. So many ways that it can show up is if you haven't addressed issues that are in your relationship. Let's say you're the one who has the chronic pain and you're having high pain levels, like a 10 out of 10, and nothing is helping. You're uncomfortable and you're not sleeping. So if you're not sleeping, your body's not having any time to, try and heal itself. So anything that used to bother you before about your partner is going to come up and bother you now even more. And you're not going to have the resiliency, you're not going to have the patience that you used to have for those types of issues. On the flip side, if you're the loved one who's kind of the caregiver, who's now maybe doing more jobs around the house or more things because the person who has the chronic illness can't, and there's issues that you've never spoken about before either, same thing. That person could be more irritated, more on edge, more irritable. So both parties can become very irritable, angry, and it has nothing to do with the chronic pain or the injury or the illness. It has to do with what's underneath it that was never addressed before it came.
Yeah. Well, and of course, the go-to treatment for chronic pain, and another big effect on your relationship, is the whole painkiller. Everybody or the doctors, I should say, just go to the script pad to help alleviate, which sometimes is necessary, but unfortunately that's also caused a crisis with side effects that can destroy a relationship, especially a sexual relationship, right?
Yeah, definitely. So if you're in a situation where all you're doing is popping pain pills, you're not going to be even present. And it's really sad because you're just trying to escape what you can't escape. So it's good to kind of look in all different avenues of what you can do with your chronic pain, with your injury, with your illness, to find what other ways that you can kind of handle things. And a lot of it too is to work with a coach or a therapist on how do you manage your pain? Because a lot of times it's talking through it, it's processing one, chicken or egg. Were the emotions there before the chronic illness or injury? And it came during the chronic illness and injury. And there's some things that your partner can't understand, especially if they've never been through an illness or an injury with chronic pain. So you need to be able to have an outlet somewhere. So yes, you can talk to your friends, but that's going to get old. I'd really suggest speaking to a therapist, a coach on what you're going through and how to process it out, because pain and illness is also a direct correlation between emotions that you've been holding in your body, or maybe there was a traumatic event that caused an injury of some kind. So now you have the emotional component of the traumatic event and the injury. Same thing with your loved one who's going through it. They can also talk to a coach, a therapist, a friend, or whatever, so they can understand how they can be supportive, what they can do, and how hard it is on them, so they have someone to speak with. And then third, it's really important that you find time to come together and be really appreciative, if you're the patient, of what the loved one's doing for you, and just be thankful and be honest about, I'm having a really rough pain day. If I say or do something that feels like I'm snapping at you, please know it's not you. I'm struggling right now. When you give somebody, that proactive kind of feedback, they get it. Does
Yeah.
that make sense too?
No, it makes a lot of sense, and you brought up something that just kind of cued something in me, and that is, the emotional side of it. That when we do have, or I read this, you're the expert here, so I'm asking you what if you agree with this, but that emotions, your mental state, can actually cause physical pain.
Absolutely. So, same thing, chicken or egg, where you're already struggling with something emotional beforehand. And then now, when you have chronic pain and illness, or you've had a traumatic event that has caused this, there's emotions around that. So, it's coupled together because the body holds the emotion, the body holds the pain. So again, having to speak up and speak out about it. And since we're talking about this, and since you brought this up, I'm going to be transparent. Of course, Silka knows about this, but my injury was twofold, where I already had a bad shoulder, arm from sports. I worked on it all last year, got to a great place. I was pretty well healed. And then 3 days later, after my last appointment, I was physically attacked and assaulted. And of course it was right side, lots of things happened to me. So I went back into a state of, worse pain, worse problems. And now I have the emotions of dealing with the pain and dealing with the attack that happened. So anybody out there who's had, whether it's a car accident, attack, whatever it might be, just to let you know, it's layered. It's layered. So sometimes you'll be going through, this is for the patients and for the loved ones. Sometimes your pain level can be really high. And if you're working with the therapist to figure out what is it holding in there, and maybe it is part of the injury, maybe it is part of the car accident, maybe it is something else that happened to you years before. Each time you work on that and release it, sometimes the pain will start to just, release, and you'll get some relief in a different way until it goes to the next layer.
Yeah.
So it's like life. It's a layered approach. Chronic pain's a layered approach. Caretaking for your loved one can be a layered approach. Relationships are a layered approach.
Yeah, no, it's a great point. And I, with my condition, and as most of my friends know, and I have arthritis, and it's you can't really compare pain from one to the other. I would probably say a mild chronic form of pain that I have. I try to stay very active, and that helps, which is one of the things, sometimes easier said than done. But I also, when I started reading about it, because I refuse to go on the arthritis medications and all the side effects that we've talked about, and how those side effects are much worse on your health and on your life than the help that it gives. But I think it was Louise Hayes, of course, who many people know, the founder of Hay House. There's a book she wrote, and I don't know how to cure your life or heal your life or something, but there was just a short part in it about arthritis, and that arthritis, in her mindset or her belief, and it just resonated with me, it stems from your emotions, from being tight, from just holding so much that it manifests in an actual disease and in pain. And that makes so much sense to me that I wanted to bring that up. Maybe I will link to the book. It just, sometimes just little things you read just give you an aha moment. And anyway, to me, that was a big deal.
It is a big deal. And in my practice, it's all about what does the body hold and what has your story. Your body holds your story. And what is your story and how does that create illness in your body? So it's, definitely, twofold and really important for people to understand because I think you brought up earlier, if you're just going to pop pills, all you're doing is taking care of pain management, which is
It's
important.
important.
And at the same time, you have to figure out what can I do to heal? What's being held in there? What are the fears? What are the anxiety? Whatever that might be. So it's very, very layered, very, very layered. And you have to decide, are you ready to jump in and take this journey?
Hmm.
Are you ready to deal with it? And something about arthritis and the arthritis that you have, Silka, chronic pain can be in your face when it's acute, and it can be always playing in the background. Like when you're at the grocery store and there's music playing, and sometimes you hear something that's really strong and sometimes it dies down. And that has an effect on a person when it's always playing in the background and it's always, always there. And let's just say you have a stressful day. You can take it for a while and then you have a stressful day and something happens. And then that music, that chronic pain that's playing in the background, gets forced up. And now you have all these layers again to deal with.
Yeah, yeah. Well, and in today's segment, of course, we don't solve the issue. We raise awareness because it's important that you think about how chronic pain, whether it's in your head and real or whether it's out of an acute affliction, has such detrimental effects on your relationship. So we'll link to some resources that maybe might be helpful, let you think about this a little bit more. Is there anything else that you'd like to add, Paige, before we sign off today?
Just that chronic pain is with the patient and there's always collateral damage. So, anyone that's around the patient is struggling too. So, however you're struggling, be open about it, be honest about it, get help for both of you, communicate. And if there's issues coming up in your relationship, I believe it's meant to come up. And sometimes things don't come up until you get a good kick in the ass. And, sometimes that's how it happens. So don't shy away, jump in, do what you can, be gentle with yourself, and also tell the people around you what you need and how that looks, because it's really important to be clear.
Yeah. Thanks, Paige. We'll see you on our next segment of Our Second Act with Paige and Silka.
For your second act of life.
Bye. If you haven't already done so, please be sure to subscribe to our channel. The button is right over here. Just click on through to YouTube, and when you see the little bell right next to the subscribe button, hit that too. We'll notify you every time we launch a new video. See you next time.